In this session, we are looking at a prostate, this area here, and a bladder taken from a 74-year-old man who frequently had a poor urinary stream, dribbling and incontinence for 5 years. He was admitted to hospital with acute urinary retention for 3 days prior, as well as some bleeding via his urethrum. He was semi-comatose and dehydrated, and upon examination, an indurated mass was felt in the anterior rectal wall. The patient rapidly deteriorated and died 4 days later. Macroscopically, we can see a large multinodular tumour here, projecting into the bladder lumen near the trigone of the bladder, which is this region here. It is evident that the bladder wall is significantly hypertrophied and trabeculated. Posteriorly, we can see a large mass of infiltrating tumour invading the rectovesical space, that is, the area between the bladder wall and anal sphincter. We can also see that the left ureter, which is here, has been embedded within this tumour. As this tumour is a malignant type of prostate cancer, an adenocarcinoma, we would expect to see highly anaplastic, spheroidal-shaped prostatic cells upon histological examination.
We will now discuss the microscopic appearance of the adenocarcinoma of the prostate, also known as prostate cancer. Once again, we can view the tissue or the architectural changes of the tissue by taking an ultrasound-guided fine needle biopsy and subsequently staining the fine tissue that we obtain using hematoxylin and eosin. Under these conditions, we may be able to see both normal and abnormal or cancerous tissue. The normal tissue is characterized by these very large gland-like structures containing secretory material shown here in pink. These secretions occur through the epithelial cells lining the luminal side of the glands, which produce the secretory material for mixing with the ejaculate. Surrounding these gland-like structures is the muscular stroma. These muscle cells align themselves in vectors, as you can see here, and typically they look like skeletal muscle. And the muscle is used to squeeze the glands and move the secretory material into the ejaculate at the appropriate time. In the cancerous case, we can see that there's been a proliferation of these gland-like structures, and there are many, many smaller, non-functional type glands evident in the tissue. What's also evident is that there has been a high proliferation of the stromal muscle cells, indicative of proliferation or uncontrolled proliferation, typical of the enlargement of the prostate in these nodular cancerous growths. Epithelial cells are also becoming highly proliferative within the gland-like structures and fusing together. If you look at the nuclei here, shown here in purple stain, you can see that typically the nuclei in a cancerous state shows a very enlarged nuclear to cytoplasmic ratio relative to the normal nucleus size, say in the stromal muscle shown over here. So the key characteristics of the cancer are a proliferation of gland-like structures, in some instances proliferation of epithelial cells, and also proliferation of stromal muscle cells, again typical of this developing adenocarcinoma of the prostate.